Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is a video about a useful biomarker to assess antioxidant status. As per usual, nothing that I say should be construed as any type of medical advice. I can only give advice to folks who are my patients, and we're in a doctor-patient relationship. So please consult with your own healthcare provider before making any health decisions for yourself. So this is just for informational purposes. So antioxidants are incredibly important for a wide range of different reasons. Probably my favorite reason why antioxidants are important is because they're just incredibly helpful for maintaining the health of our mitochondria. I love talking about the mitochondria because, in my humble opinion, I think that their healthy function is at the root of all of our good health as human beings. And if our mitochondria are disrupted, then that's ultimately what gives way to disease. So whether you're dealing with chronic illness or non-chronic illness issues, mitochondrial health, super important. And basically the mitochondria, as they're making energy for our cells, because they make all the energy for our cells, well, I mean 90+% of it anyways, they create sort of hazardous byproducts as part of that process. They can create these things called reactive oxygen species, which are the opposite of antioxidants. And so we need antioxidants in order to neutralize those so that the mitochondria themselves don't get damaged, or they don't start leaking reactive oxygen species into the cellular space around them, and then those reactive oxygen species cause damage to other cellular structures. So antioxidants, super important for that reason, amongst other reasons. So wouldn't it be great if we had a test that would tell us what a person's antioxidant status was like? And I think the answer is yes, that would be incredibly valuable. Where it gets a little bit tricky is that just because we can test certain antioxidant levels in the blood doesn't necessarily mean that that is a clinically useful thing to do. To my understanding, if we test antioxidant levels like vitamin E in the blood or glutathione in the blood, those levels can, or vitamin C, those levels can vary a lot throughout the course of the day. And so to my understanding, if I get tested today at 3 o'clock in the afternoon, tomorrow at 3 o'clock in the afternoon, later that day at 6 o'clock in the afternoon, my levels of glutathione, vitamin E, vitamin C, etc. might be quite a bit different, because it just depends on how stressed am I. Am I detoxifying things actively at the time? When did I last eat, etc. So having a reliable, so just because we can test something in the blood doesn't necessarily mean it's a reliable or reproducible marker. One marker that I've found to be very clinically useful in this regard, because I've seen it in my clinical practice at least act as a reliable and reproducible marker, is something called oxidized LDL. So LDL is low density lipoprotein. I think unfortunately known as bad cholesterol on a cholesterol panel. I really don't feel like it's bad because our bodies make it for a reason. We need it to live. However, if there's too much of it, then it is one of the factors that's associated with increased risks of heart attack and strokes. Now, that whole topic is actually, to my understanding, a little bit more nuanced than that, but I'll leave that for another video for another day. But the long and short of it is that if LDL becomes oxidized, then it essentially becomes damaged, and it's in a state where it's more prone to get incorporated into atherosclerotic plaques in our cardiovascular systems, and therefore predisposing us to heart attacks and strokes. So by measuring the oxidized LDL level in the bloodstream, to my understanding, it provides a pretty good surrogate marker to get a sense of what a person's overall antioxidant status looks like, because it's not measuring the exact levels of things like glutathione, vitamin E, vitamin C, superoxide, dismutase, catalase, peroxidase, etc. But it is measuring a downstream marker to say, well, if there's enough antioxidants floating around, then hopefully they're going to keep up with the demand to keep that LDL from getting oxidized. Whereas if there's not enough antioxidants floating around on average, that LDL is going to be more prone to get oxidized. And so what I've found in my practice is that when I test patients and I see that, oh, they have elevated oxidized LDL, then that oftentimes will correlate with patients who are having symptoms that might be associated with low antioxidants. And then what's, I think, particularly compelling is that when they're treated with antioxidants, things like vitamin E and glutathione and things like that, and then we retest their level of oxidized LDL, lo and behold, we see the level starting to come down and normalize. And we'll see oftentimes other positive clinical changes and maybe some other positive lab markers as well. So I'm certainly not insinuating that there aren't other biomarkers that can be useful to to assess a person's antioxidant status. There are some other objective tests that can be useful, and I can talk about those if there's interest amongst the online community. So feel free to post questions about that if you are so inclined. But what I found to be what I feel is the most useful marker so far in my clinical practice has been this oxidized LDL. If there are markers that you've heard about or that you've used or your doctor has prescribed for you or whatnot, please mention that in the comment section below. There may be tests out there that I haven't heard of or that or something. I'd just be curious to know what people are using or what kind of tests they've had done. So I hope this information is useful. If you have any questions about other topics, I'm happy to answer those if I'm able to, and I will leave it there.